I hope everybody can hear me okay. Good afternoon, everyone, and welcome. My name is Toyoshe Oyeyemi, and I have the distinct pleasure of welcoming you all as the host of the first State of the Social Mission discussion. One of the purposes of this session is for folks to have a better understanding of what exactly it is that the Social Mission Alliance does. And in a few moments, I'll hand it off to my colleagues to share about our collective work and how those who are on this call can be involved. Another purpose of course, is to familiarize the Social Mission Network to some of the names and faces of the project teams and the initiatives that they lead. But before we get to any of that, we want to address what I'm sure are two burning questions that some, but not all of you may already know the answer to. What is Social Mission and why did we change our name? So in both very important questions, and we'll start with the first. Social mission is defined plainly as the contribution of a health profession school in addressing inequities through its policies, practices, programs, partnerships. So simply put, what is it that nursing, medical, dental, pharmacy, public health, et cetera, schools are doing that advance student and workforce diversity, the lived experience of students in the learning environment, what they specialize in, where they go to practice, how they practice once they get there, the confluence of all of those things. Why does any of that matter? And the answer really is it matters because we know that if schools urgently transform their processes to reflect the greatest need, if schools commit to producing diverse, courageous, well-trained, well-distributed health leaders, society is going to be better off for it. By the very nature of the fact that our entire health workforce goes through health profession schools, touches the health profession school at some point, we'd argue that it's actually maybe the most comprehensive target for improving the nation's health. And that's even before we get to all the other roles that health profession schools play as employers, as partners to community coalitions, as producers of preventive health, education research. The list goes on and on. What Social Mission does is it drives this vision and this question for us, which is, what if we actually eliminated the need for individual disruptors in health profession schools? Because we've recreated health profession programs and institutions that aren't worth disrupting, but instead are actually necessary to preserve. And that's the driving question behind the vision that we have around Social Mission. Now, for the second part, the second question of things, our renaming, it's important to know that this alliance has evolved from an idea to a movement, from a movement to a conference, and now, as I said, from a conference to what really is a full-fledged organization. When the late Dr. Fitzhugh Mullen and a growing movement of health equity leaders introduced this Beyond Flexner Alliance over a decade ago, the focus then was really on pushing medical education to be socially accountable to the inequities of society. What we did in 2020 is we began taking a closer look at the name of our organization and the direction of the movement over the course of the last 10 plus years. We assembled focus groups and interviews that probably included several of the folks who are attending this session right now, to really ask two questions. One, as we distance ourselves from the legacy of Flexner, is this name still appropriate? And two, as we've now transformed beyond medical education only and into equity through all health professions education, is this name still relevant? And the answers that this community gave to those two questions really moved us to where we are today. So I'm pleased to be able to unveil our new name and our exciting new logo, the Social Mission Alliance, which to us clearly portrays what our North Star is and continues to be, which is transforming health professions education towards social mission. I believe that the Social Mission Alliance is a name that we can all really be proud of because it reflects an ambitious but attainable ideal That is that what goes on both inside of the halls and outside the halls of our healthcare training programs really has an oversized impact on justice and equity. And that's what we're all about. So over the next 30 minutes or so, we're going to share our vision for what we believe health professions education should and could be, share more about the Social Mission Alliance aims to get there, and of course, invite each of you to reflect and respond on how we can achieve this ambitious social mission agenda together. I've invited a handful of our social mission colleagues to not only explain the concept of how social mission can lead to real change, but also the steps we're taking, informed by our larger community, to take action now and move this agenda from a concept into reality. We start at the center of our strategy with research, and I invite our research lead, Meg Zeman, to frame this for us in just a moment. Then we'll describe our cornerstone convening initiative, which is our conference, then our advocacy targets for change, and followed by a discussion on one of the major topics that will influence health professions education and the workforce for years to come. And since this is only a short introductory session with obvious time constraints, what I'm going to ask is for folks to drop into the chat for any questions or comments that you have as we go along, and our chat moderators will facilitate those points while there. Welcome again.
Good afternoon, everyone. Thank you so much for being here. My name is Meg Zeman, and it's a pleasure to be with all of you this afternoon. I am co-chair of the Social Mission Alliance Research Advisory Committee. I'm also a research scientist with the Fitzhugh Mullen Institute for Health Workforce Equity, where I've been involved in multiple studies at the intersection of equity and health professions education. And I have the perhaps ambitious task of getting everyone on this call excited about social mission research over the next 5 minutes. So bear with me and I will do my best. In the prior slide, Toya Shea highlighted some of the Social Mission Alliance's research activities, such as the Health Workforce Diversity Tracker and the Social Mission Metrics Initiative. I want to pull back the lens just a little bit and talk about social mission research as a field a little bit more broadly, and then what we see as Social Mission Alliance's role in it. And I want to just start off with the basics. What is social mission research? That would be any research or evaluation that's focused on health professions training programs, contributions to advancing equity and addressing health disparities. And we know that there's a lot of interest in social mission research. We know this from the literature, and that the field is expanding as awareness of the role or potential role of health professions education in advancing health equity grows. But this slide speaks to the fact that there's a lot of variation in the current evidence base when we really dig into the literature, as we have done before at the Mullen Institute, to look at the direct links between social mission inputs and those outcomes that we want to get at: the diversity, primary care practice, high needs coverage, equity within and outside of the health profession school, and health equity leadership. And just to briefly walk you through the visual that you're looking at, the important thing to keep in mind is that that red dashed line demarcates the graduation point for health professions trainees. There's a lot of good evidence to the left of that line. For example, we know a lot about the relationship between pre-admissions and admissions activities and its effect on increased diversity. We also have a lot of research demonstrating that elements of health professions education and training can improve student knowledge, competencies, attitudes in areas that we think are really core to social mission. But to the right of that red line, after the point of graduation, the evidence base for how education and training translates to the where, what, and how of practice, and more importantly, to health equity more directly and the reduction of health disparities, is much weaker. So this gets me to, why is social mission research important? The innovation in social mission programming is super exciting. We see it play out on the daily. A lot of our colleagues are involved in it. But we don't want social mission to be thought of as experimental or in a pilot phase or on the fringe, or just by way of these individual disruptors, as Toya Shea mentioned. If we really want social mission of health professions education to move from experimentation to mainstream adoption and implementation, we're going to need to continue to build the evidence base around social mission activities and particularly measure outcomes beyond the point of graduation. And if you can go to the next slide, please. So this is a need that's been called out by many researchers and that my colleague Cleese Erickson and I reiterated in a published call to action for the advancement of social mission research, in which we laid out a roadmap of foundational milestones in the field of research, like identifying and addressing data needs and coalescing a diverse social mission research community. But core to achieving these milestones is going to be leadership from an organizing body that can serve as a hub for social mission research, engage stakeholder groups, and really building that evidence base for social mission strategies that will ultimately lead to health equity. And this is where the Social Mission Alliance has a big role to play. Next slide. So the Social Mission Alliance is what we see as a powerful vehicle for research advancement. And you can perhaps think of the engine for that vehicle as the Social Mission Alliance Research Advisory Committee. The committee's aim is to advance social mission research by organizing the research community and engaging key stakeholders in social mission research activities. We currently have 15 members, everyone from students all the way through deans, representing 7 institutions and multiple disciplines. We engage in multiple activities to advance social mission research, with many others planned, ranging from building out the actual social mission research agenda to organizing convenings to address some of those research needs, to providing mentorship for junior researchers, and just highlighting and sharing of the wonderful research that's going on in the field. And so I'll leave you with just a call to action and an invitation to join us in our social mission research endeavors, either just by reaching out and sharing your own research or great ideas that you have for research or research needs, or by joining the Social Mission Alliance Research Advisory Committee, and we'll follow up with the ways that you can get involved more. Happy to answer questions at the end of this webinar, and I really thank you for your time this afternoon.
Thank you, Meg, and thank you, Toyosi. For those who I have had the pleasure of meeting, my name is Jamar Slocum. I am a clinical assistant professor of medicine at George Washington University. I have the pleasure of working with amazing colleagues on the conference. As many of you may have known, Beyond Flexner Conference, the SMA, has a longstanding tradition of convening and engaging with interdisciplinary healthcare practitioners, educators, and elected officials throughout the country. Our first conference was in 2012 at Tulsa, Oklahoma, partnering with the University of Oklahoma School of Community Medicine and the University of Tulsa. At that conference, we attended and organized hundreds of clinicians, educators, administrators, and public servants with keynote addresses by Dr. David Satcher, the late Jack Geiger, and a mentor friend and our brilliant founder, the late great Dr. Fitzhugh Mullen. Since 2012, we've organized 4 astonishing in-person conferences and 1 online conference with guest speakers and keynote speakers by the Honorable Andrew Young and Soledad O'Brien. But we cannot do this alone. We had amazing partnerships along the way with Florida International University, Morehouse School of Medicine, and more recently, ATSU, AT Still University. So continuing with that tradition of convening, engaging, and inspiring and educating, it is my pleasure to announce that we are working on an upcoming conference for the spring 2024. And I want to encourage you to check your emails and the website for more information for time to come from that. We have an amazing team, and we are reimagining what a conference should be by ensuring reasonable fees, interactive sessions, and providing you with tangible and solutions that you can take back to your own institutions to see the change you want to see. So please continue to check for that, and please come join us in the spring 2024. And now I'll pass it off to my colleague and friend, Dr. Robert Rock.
Thank you so much, Jamar. And greetings, everyone. My name is Robert Rock, and I'm the Social Mission Alliance's Director of the Health Justice Fellowship. I support the Student Assembly in its programming, and I lead the Advocacy Advisory Council, which I'm happy to speak to you about right now. In my other life, I'm a practicing family physician doing a postdoctoral fellowship in health services research with the National Clinician Scholars Program. So next slide. Historically, the Social Mission Alliance has been an organization focused on research, convening, and community building around social mission and health professions education. As the Social Mission Alliance takes on a new name and enters a new phase in the history of the organization, a strategic goal is to leverage the extensive research expertise and professional relationships garnered over the years for advocacy in the area of social mission. Our advocacy goals are diversifying the healthcare workforce, directing health professions to shortage areas, and infusing social mission into health professional training accreditation criteria. Next slide, please. So the Advocacy Advisory Council is a group brought together to guide the Social Mission Alliance in the first steps of leveraging its health workforce research expertise for advocacy efforts around social mission, in hopes of putting our best foot forward, not only with formulating our advocacy platform, but with establishing a blueprint of how to do the work in an equitable and inclusive way. We selected a group of people with a diversity of backgrounds and interests and areas of expertise. So it's a group of activists and organizers with experience guiding the development of interdisciplinary advocacy efforts for social justice and health equity, dynamic leaders with an extensive network of individuals and organizations spanning various sectors that can benefit from collaborating with the Social Mission Alliance and advancing social mission and health professions education. They're also experienced mentors and safe havens for health profession students and students in general, people who are passionate in nurturing their commitment to health justice. These are individuals with experience straddling professional societies and community-based organizations in their effort to advance and advocate for change. Ultimately, these are people with a demonstrated commitment to racial justice and intersectional approaches to coalition building. Given the brief time we have now, I'm only going to name our council members. However, we will be spreading the word about them on social media platforms soon. So from the top left and then going clockwise is Professor Devarian L. Baldwin, Ashanti Carter, Addis Marie Castillo, Stephanie E. Farquhar, Kiala Jacques, and Manisha Sharma. Next slide, please. So the Advocacy Advisory Council is the start of developing and implementing an advocacy strategy. We're power mapping while we explore how to engage non-traditional partners in forming advocacy coalitions around these issues. We're also developing media strategies that translate research into impactful messages that reach the widest audience, both among the general public and policymakers. We're thinking of how we can highlight the work of groups at advancing health equity as a means to tangibly display what social mission looks like. We want folks not to just understand the definition of social mission, but to feel it too. And next slide. So the Advocacy Advisory Council is just the beginning, and it's far from the end. We're interested in growing this work as we hone the structure and guiding agenda. And if you're interested in taking part in the advocacy efforts with SMA, please reach out to me and to Rashmi Krishnasamy via info@Social Mission. I just ask that you include Advocacy Advisory Council in the subject line. And with that, I'll hand it over to Ed to bring this conversation to the pressing issues that, us as educators in this country are dealing with. So Ed.
Thank you. I have some continuity, connectivity issues, so hoping you can hear me. Next slide. So we all know that the Supreme Court is considering two important cases around affirmative action. Next slide. Which could have a very significant impact on our ability to produce a diverse health workforce. The documentation is there. The nation has done a very poor job in terms of representativeness in our health professions. We've published on that. There has been some slow progress over the last 20 years. The studies we've done have shown that the pipeline is more diverse than the existing workforce. But all of this is really in danger with the Supreme Court decision. We obviously don't know what the Supreme Court will be deciding, but all the signs are not good. And so if the Supreme Court sets back affirmative action, we really are very concerned that it will set back many efforts to increase diversity. So what we're interested in doing is to put together an ad hoc committee of SMA members and others who are concerned about this to understand what are institutions doing in preparation. What are the thoughts about what the SMA could do and should do going forward? And are there alternatives to affirmative action that in fact would be acceptable to the Supreme Court? We think this is just a really critical issue. We've been struggling for many years to have a more diverse workforce, and it feels like we've been making some progress recently. We have a tremendously far way to go yet, but we think that this decision is really important. I encourage anyone who's interested in working with us to sign up. You can sign up by emailing me, and Katie Webster will put a link, and we'll send a follow-up link going forward. We're calling it an ad hoc committee because we're really not sure how far and how long we will go. We don't know what the decision is, but we thought it would be important to come together now before the decision to understand where educational institutions are and to understand what some of our options may be going forward if the Supreme Court decides, as expected, to set back the use of affirmative action. And with that, I'll turn it over back to Toya Shea.
Yes, thank you, Ed, and thank you all for that input. I'd like to turn it over to our chat moderators to find out if there is anything in the chat that we can reconcile right now or address, or any questions for any of the speakers.
Things are looking pretty good in the chat, but if anyone else has any questions, please feel free to drop them in.
While we're mining through the chat, I would like to invite anybody who would like to feel free to raise a hand and come off mute once you do, to ask any questions regarding the direction of the social mission or any of the details of the initiatives that were presented. We did slot out this last couple of minutes to be able to do that. I also want to assure folks that because of course, the limited amount of time that we have here, that we understand that the expectation is for us to have this as a continuing conversation outside of this really narrow window that we have to be able to interact and converse with this network. So I certainly invite additional questions to our email address, which can be found, I guess it's not on this slide, at info@socialmission.org, or can be directed to any of the program and project leads. And before going off into closing, I do want to just check one more time with the chat moderators if we do have any other questions in the chat.
We do not have any other questions at this moment.
Excellent. Great. Folks, for the sake of time, we're wrapping up our inaugural State of Social Mission webinar. I'd like to extend a major thank you to each of you for attending, and to each of my colleagues for sharing. I once again want to make sure that I invite members of this network, our broader network, and those who may not be on this call, but may be connected to you and your own networks, to please continue the conversation with us and reach out. In closing, I really want to reiterate our team's commitment to this cause of social mission and remind everyone that the most important resource that's needed in order for us to really accomplish this agenda and some of the initiatives that we've highlighted here is the partnership of the people who are part of this network, the people who are in the session and those who are not in the session right now. As Katie mentioned, and I believe it was mentioned earlier as well, you will receive a follow-up note that details how to connect with any of these initiatives, as well as some exciting others that we didn't have an opportunity to dive into deeply today. And even with those that we've yet to explore, that you all lead or suggest that we should connect with. So unless there are any final calls for questions, and I'll check with the chat moderator one last time before closing up.
We seem to be all good.
Still good. Then thank you, and we'll see you soon. Thank you all for attending.